Representative Gottwalt has a bill, albeit is intriguing and I think poses some good questions that we have to answer. Is in no way really the stage where it can be implemented. The fiscal note, and what a fiscal note is when we introduce a bill, the department does a fiscal analysis and says this is how much it's going to cost, this is how much it's going to save, that's how we budget, that's how we get our information. The fiscal note says that there are so many uncertainties and so many questions that aren't asked that we can't even tell you if it's going to cost us money or save us money or anything. And Representative Gottwalt really likes to tout this as huge, major reform of Minnesota care, which in no way it is not at this time. It's got some intriguing questions with trying to use private insurance to cover some of the Minnesota care recipients. Private insurance does pay at better rates than what public insurance does. But you can't have the best of all worlds. It can't cost less, it can't pay more, and it can't contain all those components without somebody saying, well, why is it that way? And one of the questions that needs to be posed is, are we paying right now the health plans too much for our public health plans involved in Minnesota care? But Representative Gottwalt's bill has had a fiscal note of actually costing us $30 million. So he likes to say that there's a $200 million cost savings. That is not quantified in any measure within the Department of Human Services, within the administration, within the House of Representatives. None of that is quantified, and we have to work out quantifiable numbers. We can't simply introduce bills and say, well, it's going to save us $50 million. Let's pass it and let's count it on our budget, because that's not the way we work. We have to have actuarial soundness in our bills. We have to have, his bill just is not ready for that. So I get really frustrated that simply throwing a bill that has some intriguing questions to answer it is not the approach to reform, especially when you don't even have any of those questions answered. So it's, we'll consider it. I think the legislature will consider it, but I think it was introduced in the last 3 weeks of session, and we have no answers.
We were told that the department just didn't think it was worth their time to try to figure it out because it was just too unformed. So if you can't have a proposal, it's just a concept.
And then also his proposal also didn't say what the plans would have to cover. It did not say what the benefits would be. I mean, it was just.
It was a high deductible.
I mean,
that's a concern I have when you're talking about people who can't afford to independently purchase their own health insurance. In general, they're not going to be people who are going to independently be able to just start throwing out a bunch of money to go to doctors, which means we're reverting back to an emergency room scenario. So unless it's actually going to provide real services, it's hard to see how it's actually going to be helpful in the long run.